Welcome to The Nest. We are a community of moms, right? And moms-to-be, focusing on yoga and education for parents-to-be and new parents. My name is Ifat. I'm the lead teacher, and today I have Dr. Gena with me from Gena Chiropractic.
Yeah, hi guys.
Hello.
Nice to meet you. And you also have a special guest as well. Baby Dylan's here along for the ride.
Hi, baby Dylan.
Yeah.
How sweet. All right, so Gena, I would love for you to explain to our viewers first, I guess, what you do, just kind of in short, but really focusing on how is chiropractic care helpful for pregnant persons as well as new moms. And I know you do chiropractic care for babies. So if you can explain the benefits so people can understand why.
Sure. So first off, thanks for having me on. I'm happy to share this information because it's highly beneficial, whether you're expecting, prenatal, postnatal, and beyond. So what we do is, I actually have my spine here so I could explain this. What we do is we work with the spine. And the reason why that's important is because it really lets us access your nervous system. So every single thing that happens in your body is controlled by your nervous system. That's your brain and how your brain sends signals to the other parts of the body. So what happens is the brain's up here and it sends signals down the spinal cord and then out the nerves which pass between the bones. And the bones all move. It's how you move your body, but sometimes things shift and get stuck out of place. And when this happens, it puts pressure on the nerves. So instead of the messages from the brain out to the body coming through clearly like this, the messages can end up coming through like this. And this is called the subluxation. Now this is where we have more tension and less ease in the body. And as a result, oftentimes body systems or parts of the body don't function at their best ability and can show up as symptoms or other many different ways. So for example, when it comes to pregnancy, a lot of times that'll show up as, yeah, we're going to tell them. A lot of times that'll show up as things like sciatica, issues with breathing. When you're dealing with postpartum, when you just had your baby, now you're maybe bottle feeding or breastfeeding and you're bending over a lot. That's when we're going to see more of that like neck and upper back tension coupled with dealing with not sleeping. So our nervous systems and our bodies are under increased stress. So there's lots of different ways that our body gets exposed to stress, and stress is what causes more of that tension or interference in the nervous system. And that's what causes us to have such a small piece of it is pain, but really start to function well below where we should be. And a lot of times doing this, December is going to be 12 years. A lot of times people think that if there's no pain, there's no problem, but you might be surprised to find out that less than 20% of the nerve fibers transmit the pain signal. That's 80% of the body that has to do with how you function. So that's things like pooping, peeing, your heart beating, sleeping, whether or not you feel anxious, every single function that happens. So I strongly recommend having an evaluation. And a lot of times people are, especially pregnant moms, they're nervous about, you know, I want to wait till there's a problem, which you can do, but the sooner the better. Because you can always be proactive. And I want to real quick just kind of show you, I don't have a pelvis attached on this one, but what happens is as you're getting closer towards delivery, the body's going to release something called more relaxin, which relaxes all the ligaments. That allows everything to open up, which you want that, especially in the case of a vaginal birth, because that's Dylan speaking, because things need to move in order for you to have more ease and for baby to be able to pass through. But what happens if one side of the SI joint in the pelvis is moving with ease and the other side's fixated, stuck, or subluxated? Then we can end up with other issues of things like breech positioning or not ideal positioning during labor, like back labor. So there's so many different ways that this could be affected, and proper alignment also helps you with your recovery piece as well. And this is the same for C-section moms too, because those tensions, those areas of interference happen as a result of chemical, physical, and emotional stress. And if you're having a C-section, you've got all three of those. Same thing for vaginal uncomplicated birth. You're exposed to all of those. So pregnancy, our moms love it. I will tell you that in the 4th trimester, they love it even more, even if it was their favorite thing during pregnancy. And we also do work with babies for the same reason. This is all about how the brain and the body communicate. And so if there's that clear communication, the body has more ease with growth and development. So again, you don't have to have a symptom or a problem to bring your child to see us. However, many parents do bring their kids to see us for things like frequent ear infections, constipation, colic, reflux, torticollis, and parents come in sometimes and they're desperate, Ifat, especially if you have a colicky baby or a baby with reflux. And the last thing you want to do is see your brand new, beautiful baby suffering. And we have drug-free, surgery-free, gentle solutions that have quick results to help your babies have more ease, which means parents have more ease and relationships have more ease, because it can be really stressful when you're not sleeping and your baby's stressed out and you're just trying to survive.
Right. So you're saying basically when it's pain, it's kind of like a little bit late, even though we can figure it out and fix it. You're talking about maintenance. You're talking about like going as just regularly going, making sure that the body has great flow, that the brain is communicating well with the rest of the body. So all our functions that we maybe not even aware of or paying attention to, right? Because we only pay attention to it if there is something
when there's a
wrong.
Yeah.
Right.
So the body has
This is a general maintenance.
Yes to both of those though, because I don't, obviously, especially my pregnant moms, I don't want them suffering with pain. And let's face it, pregnancy puts a lot of stress physically also on the body. So it is highly likely that you may not be feeling your best, or that you have pain during pregnancy, round ligament pain, all these different things. And we can help with that. So I don't want anyone to feel like, well, because you didn't come in sooner, we can't help you. Chiropractors can help you. And you can also, there's a great resource. It's called the ICPA. It's the International Chiropractic Pediatric Association. And you can find a chiropractor who has experience working specifically with pregnancy, pediatrics, peri and postnatal care. And there's also something called the Webster technique, which is a specific certification that we can get that allows us to do, it's a specific check, assessment, and adjustment of the pelvis, and most specifically the SI joint, the sacroiliac joint, along with the bone, muscle, and ligament. So yes, you can wait till you have pain, but why would you when you have another option?
Right. And so most chiropractors also take insurance?
I wouldn't say most as a general statement. I would say a lot do. I think every office is different. So if you find I think the number one thing is that you find a provider you feel comfortable with. That's first and foremost, because that provider may very well be in your insurance network. And if it works out that way, that's fantastic. They may be out of your network. And if that's the case, maybe you have a high deductible, or even for in-network. And then it's like, well, it's going to cost a lot of money to go. A lot of offices have a self-pay option as well. So it really depends on, number one thing though, is that relationship, because I've gone to places where it was like, okay, they take my insurance, but I wasn't happy. So it didn't matter that I was paying less through a copay to see the providers. I didn't feel like I was getting the benefit no matter what amount I was paying. And sometimes it is okay to go out of pocket because you're getting a specific service. And keep in mind that when you are seeing chiropractors who have extra training in pregnancy and pediatrics, they've invested a lot of extra time in order to be able to better provide this service. So always remember that there is a cost involved. Obviously, I get it. Sometimes we have to shop around and do, there's a lot of, I just had my kid 5.5 months ago. There's a lot of fees and things that come up that you don't even think about when you're pregnant and having a baby. But I want to be really clear about that, because it's really important that no matter who you're seeing, this is the same thing with your OB, your midwife. Like, if you're not happy, you can find or switch to another office or facility where you feel like you're being heard and that you're being cared for in the best way possible during this most important time for you and your baby's life.
Right, of course. No, I agree. I've been to providers that were on my insurance and ran away.
Right? And sometimes they're great. And when it works out that way, you're like, cool, this is why I pay all this money every month for insurance. I actually get to use it.
Right.
So, it's funny. Insurance is a funny thing. Insurance is not healthcare. Insurance is sick care. And it's important to remember that, right? So if, God forbid, you really, truly are sick, there's, God forbid, an emergency that happens, a surgery that you need, medication that you need, that's where insurance shines, right? When it comes to health maintenance or just being a healthy individual, that is not what insurance is for. It really is sick care. And we kind of have it backwards because we're taught this is our health insurance. It's really our sick insurance. Health insurance is going to be eating proper foods, getting exercise, moving your body, getting adequate sleep, which I'm currently not doing, having a positive mental attitude, and most importantly, having a clear brain-body connection like we just talked about. And that's that chiropractic piece. But there are things we could do, like yoga and meditation, deep breath work. These are healing things that are extremely important that our insurance probably isn't going to cover, and that's okay, because they
Right.
are very much necessary for us to be our healthiest self.
Right. And one last thing before
Yeah.
I let you go, because I know he's being very patient, by the way.
He's the best. Let's just give him a big shout out. That's a bottle full of
He's
there.
being super patient. Look at that. Hi. So a lot of people are scared. Like, you know, you think about chiropractor and you think about like that cracking of the
Sure.
neck and all that, you know, kind of like looks violent, kind of thing. So a lot of people are like, oh my God, no, I'm not going to a
Yeah.
chiropractor. But could it be different? I mean, and I'm sure for babies, it's not
It's
cracking.
very different, first of all, for babies. And you brought up a
Right.
great question, because a lot of first time people, and these are even my big bodybuilding men, are scared when they come in, because they're like, you know, whenever you're exposed to something that you've never had an experience with before, oftentimes there's some fear there because we just don't know what to expect. And that's why I think it's also important that you work with a provider who is going to take the time to explain things to you and answer your questions, so that you walk in there with less stress, right? This is the whole point of this, is to reduce the effects of stress, not add to it. So I want to touch on a few things. Number one, when we're working with babies, it's pressures, and it's no more pressure than you'd put on a ripe tomato before it starts to indent. So a lot of times babies are sleeping. A lot of times babies will sleep during their adjustment. And this is a chiropractic baby. I was adjusted my entire pregnancy, and he was adjusted from 1 hour old and his entire life. He gets an adjustment every single week. And I want to be clear that it's not because something's wrong with him, and it's not because I'm crazy, but it's because that brain body connection is so vitally important for him to function and develop at his very best. So when we're working with babies and kids, it's pressures. A lot of times babies sleep through their adjustment, or we sometimes also do use instruments. We have something called an activator. It's like a clicker. It makes this little sound. And when we use it with babies, we actually do it through our finger. So the force is even less. When it comes to adults, most specifically with pregnant women, we have them lay face down. This is part of the Webster check. So we have special pillows, and there are other offices that have a cutout in the table, so it's comfortable for your belly. We're not going to keep you there long, but we do need to be able to assess the pelvis in that position. Mostly when we're working with pregnant women, or mostly working with the craniosacral areas, meaning we're not doing a lot of stuff in the middle back, because that activates more of the sympathetic nervous system, which is a fight or flight space. And we want our moms in more of that parasympathetic space, which is feed and breathe, rest and digest, more ease and relaxation. So if you've been to the chiropractor when you weren't pregnant, and then you go when you're pregnant, it could be a very different experience, because again, that chemical that the body makes called relaxin, we don't want to create more torsion or other issues in the pelvis once we start doing that work. So let's talk about that sound you asked me about. When you hear that sound, nothing is cracking, popping, or breaking. What that sound is gas or air coming out from the joint. There's no empty space in the body. So if something shifts or moves, air builds up in there, and that's what you're hearing released. And it's funny because people ask me, do you do that thing where you break people's necks? And I'm like, listen, that's really bad for business. We don't do that. You know, they're like, I saw in the movie that they did this thing and they killed the guy. And I'm like, where did you see it? Oh, in a movie? Yes. We don't do that. We're never going to bring you past the end range of motion of a joint, meaning there should be ease throughout the entire experience and process. And if you're working with a provider that you feel comfortable with, you can voice that you feel a little nervous, or you're not sure what to expect. And they, if it's a good provider, they'll work with you to make sure that you feel comfortable and ease. And sometimes people get freaked out about the sound and they're like, I don't know that I could have that. That's okay. We have instruments that are extremely gentle that we can use in those scenarios too. So I just want to put out there that I get that people are nervous. I get that it can look crazy, but I want to encourage you to, in spite of that, still let yourself experience it, because once you're the patient on the table, you'll very quickly realize that it's gentle and it feels great and it helps you be your best.
Awesome. Good. Yes, I wanted to make sure that people are aware, and because I mean, I've been to the chiropractor many times before and it never hurts. So
yeah, it's not supposed to.
Sometimes it sounds weird, but it never hurts. So
yeah,
it sounds kind of scary if you've never done it before and you're like, oh my God, I don't want to do that. So, but you're saying that during pregnancy, and for sure for babies, it's way more gentle anyway. So
Yeah, and there's sometimes you do hear those pop sounds when we're working with pregnant women, but when we're working with babies, we're not. And we don't do any, like the manual adjustments on the neck that you might see when we do with adults. We don't do that with kids until they're the age at least of 7, because that's when the uncinate process is finished forming. Those are the joints in the neck. So again, that's why I encourage you, especially if it's pregnancy and pediatrics, if you're thinking of bringing your baby or your child to the chiropractor, that you specifically seek out an office or a provider that has extra training in this, lots of experience in it, and most importantly, a passion for it. Because let's face it, when you bring your little kid to the office, you need to be in a situation where maybe your kid's hungry, you need to breastfeed them, and that needs to be okay. Or maybe you got to change a poopy diaper, or maybe your kid's tired and getting cranky and having a bad day, and they need to work with you on that. So it's just important that whoever you are going to see, they're going to be welcoming and that you have your best experience possible.
Awesome. So we will share your information for anyone in the area, and we'll also share that website that you mentioned if they want to look for someone who specializes in pregnancy and pediatrics in other areas. So
Absolutely.
we'll do that.
Yeah,
awesome.
The ICPA is a great resource for that. And if you guys have any questions, whether or not I live near you, or even if you have another local provider, I'm happy to answer that for you. It's just really important that everybody have a checkup.
Right. Thank you so much. I know, just in time. It's just in time. We're done. We're so done. That's it. All done. Yay. Thank you so much, Gena.
I want to thank you so much because I really enjoyed my prenatal yoga classes that we did together, and also the postnatal classes that we did, even though it was virtually. We loved it. Dylan had so much fun. Thank you.
Thank you so much. Have a beautiful day. Happy holiday and a good weekend.
Have a great day.
Bye.
Thank you.